Chavez Camacho. I am the President and Executive Director at la Unión del Pueblo Entero, LUPE, and LUPE Votes.
And Tania, we're here today to talk about a specific executive order that Governor Greg Abbott issued, I think it was in late August. And that executive order basically requires all hospitals that take Medicaid or CHIP patients that they have to check and monitor and record the citizenship status of all patients that go to that hospital. And so my first question is, were you aware of that executive order from Governor Abbott? And what do you think of the order?
We have been aware of the order since the order was announced, and just like it was announced, we responded. And the number one thing we want to ensure that the community knows is that while the order might mandate hospitals to ask for somebody's immigration status, community members also have the right to decline. They do not need to feel compelled to answer the question, and if by any chance their opportunity to receive care is denied because of choosing not to answer the question, then they need to notify us to ensure that we are taking note of these cases. The one piece that we want to ensure community members know is that just like Governor Abbott asked hospitals to ask the questions, we as constituents have a right to deny answering those questions. And by federal law, hospitals are still required to offer the care that community members need, especially if this is an emergent incident.
So you're saying that if the patient has the right not to answer that question, and they also have the right to receive treatment for their illness or injury, even if they say, no, I don't want to answer that question?
That is correct. By federal law, when somebody goes into the emergency room, we know that oftentimes community members wait until the last minute to receive the care that they need. And so in those instances, regardless whether or not they answer the question, they should still be provided with the care they need. Of course, medical professionals ultimately are the ones who make the decision as to whether or not somebody will be triaged for care based on whether or not the instance is emergent or not. But if it's deemed an emergency by federal law, they need to be taken in as patients, whether they choose to answer the question or not.
What do you believe the impact of the order will have on non-citizens, undocumented immigrants in our community? Do you think they'll be less likely to go to the hospital when they're sick?
I think that, Steve, I grew up as an undocumented immigrant in the Rio Grande Valley. And as such, I think that what I have now being able to legalize my immigration status, just remembering what it is to have grown up as an undocumented immigrant in the United States, there's fear of, am I gonna get the care I need? Am I gonna receive the quality of care that I need to receive? And I think those are some instances where we foresee community members being afraid to seek the care that they need, or maybe delaying access to care. I also believe that there will be confusion as to who are the entities asking for this information. Many of the times, community members might feel that they cannot go to community clinics. So another important thing to know is that only inpatient services and emergent services in hospitals are the ones that are required to ask for this information. When you go to a regular doctor's office, when you go to the community health clinic, the federally qualified clinics, they're not mandated to collect this information, and they shouldn't be asking for this information. But we also know that many of our regular doctor's offices nowadays are part of the hospital system. And so I want to ensure that patients understand, that community members understand that they nobody should find themselves being questioned around this matter unless you are entering an ER or you're admitted as an inpatient in the hospital. Another thing super important is that no one should stop receiving the care that they need. So they should feel empowered to go to the doctor, empowered to seek the medical care that they need.
What are you hearing from your members and your supporters on this issue? What's the feedback been in the community?
I think there's confusion. There's confusion because we don't know how each hospital would choose to adopt these policies. Also, there's a lot of confusion as to whether identifiable information will be provided to the state. From what we have heard, part of the information that will be provided to the state are the number of visits, are the number of inpatient discharges, on whether or not they're citizens, but not necessarily identifiable information. And so they will be providing number of patients, services provided, and total amount spent on these patients. I do want to emphasize, though, that while patients have a right to decline to answer these questions, the state also may have a right to decline certain qualifying clients or qualifying patients for certain services. So what we do know is that any patient seeking emergency Medicaid coverage in Texas, it is indeed required to answer these questions. However, we have a right to not answer the question. And so that is something that, so you might not qualify for certain benefits, but you are still required to be offered the medical care that you need.
Do you happen to know what roughly the percentage in the Rio Grande Valley that are undocumented?
You know, rough estimates, we've always had a rough estimates, around 30% of the Rio Grande Valley community we believe to be undocumented, roughly. Of course, we will have to take a look at the census data, but more or less those are our guesstimates. It also comes from the percentage of folks who are who currently are uninsured in the Rio Grande Valley, and it also comes from our own membership, who majority of them, although many people believe that our membership is undocumented, actually majority of them have citizenship, have legal permanent residency, and yes, a portion of them are undocumented, but many of our services actually go to, because we do the immigration services, go to the U.S. citizens and legal permanent residents.
So this is a state order from the governor's office, from the governor himself, and therefore our Rio Grande Valley state legislative delegation should be interested in this.
Mm-hmm.
Have you as a group, has LUPE been in touch with any of the Valley delegation to express your views?
We're actually starting our outreach to the Valley delegation, and particularly as we look forward to the 2025 legislative session, because we want to ensure, I'm not sure if you know or are aware, Steve, in our cumbre, the members in our membership summit that we just had a few weeks ago, September 11, was it September 11, September 20 some. One of the big issues that came up was actually access to care. So access to care, the economy and immigration were the top 3 issues that affect the most the LUPE membership. And so we want to ensure that our Valley delegation is fully aware of the issues that matter the most. And so now that elections are over, we are starting our outreach to the Valley delegation to get us ready for the things that we need, that we're asking for them to stand up for and defend us in the upcoming legislative session.
What's your time frame for telling these legislators what your agenda is over the next few weeks?
Yes, over the next, before all of November, and before we go into the holiday break. We want to ensure that we know that the deadlines for legislation is sometime in December, so we want to ensure that they are fully aware of all the issues that matter to our community during the month of November.
In his press release explaining this executive order, the governor said it seemed as though his primary goal is to collate the information to find out how much the financial cost of caring for undocumented immigrants. And basically he said he wants to send a bill, send an invoice to the federal government, because he claims that our borders are open and therefore this is a Biden and Harris problem. They've allowed the border to be open, therefore there are more undocumented immigrants here, and therefore uncompensated care for the hospitals is going up and up and up. However, some people, some families, undocumented immigrants might think, could it go beyond that? Is it, instead of just collating the information, adding up the cost, could that immigration status, the citizenship status of those patients also be turned over to a law enforcement agency like the Department of Public Safety or Border Patrol, etc.? I know Border Patrol is federal, but is that a concern of LUPE's, that that information could be passed on to immigration agencies?
Two things come to mind. One of them is that while he may want to start tallying up how much it costs at the hospitals to provide care for undocumented immigrants, he could also very well start tallying up how much undocumented immigrants pay in taxes, how much undocumented immigrants paid in property taxes, how much undocumented immigrants provide to the GDP of the Texas economy. And so, you know, since he's at it, he might as well continue to tally up the benefits that undocumented immigrants bring to the state. Another matter at hand is that at this moment, the information that we have from our healthcare partners is that the state is not requiring identifiable information. However, we do not know the information that hospitals may feel compelled to provide. And in such, I think this is why for us, this executive order is so damning to our community, because we just don't know the extent by which the governor may choose to utilize this information. And so we are asking our community members to choose to not answer the question.
That's your recommendation?
That is our recommendation. And that we understand that by doing so, they may be left out of providing access to certain programs. But the number one thing that they need to know is that they cannot be denied access to care.
So your understanding is that the hospitals have been asked to collate this information. They're being asked to tell Health and Human Services that we've just treated an undocumented immigrant, but they're not required to say who that immigrant is.
That is my understanding at the moment. And also, many of the hospitals that we have special foundations or have a special designation for folks that are unable to afford their medical care, whether citizens or not citizens, whether documented or undocumented. And so they might not be eligible for certain programs through the state, but there might be other sources of funding able to help pay for some of the costs to provide them with care.
So I asked you, had you connected yet with our Valley Legislative Delegation on this issue? Have you reached out to the hospital systems that are affected by this?
We have.
Can I ask how those conversations went?
Those conversations have gone well, and this is where we know the type of information that is being collected, or that at least the state is requiring of the hospitals. Again, this is us having had a long-term standing relationship with some of the hospitals in the area, but we are not the only hospitals being whose this information is being requested. These are hospitals throughout the state. And while we may have a good relationship with the hospitals in that they will honor the word of not sharing identifiable information of our community members, we also know that not all the hospitals in the region are locally owned. We know that not all the hospitals across the state of Texas have a good relationship with the community. And so we exhort the community once again to choose to not answer the question about their immigration status.
Well, Tania, these are all the questions I had. Thank you for such comprehensive answers to this big issue. Is there anything I've missed? Anything else you'd like to say on this?
I think what is important at this moment is that if you're a LUPE member and you have been denied care, if you know a LUPE member who has been denied care or a LUPE member who's afraid to seek medical care because of this executive order, we need to know, we want to be aware, because we want to ensure our LUPE members are well protected and they're given the right to care that they deserve.
Well, thank you so much for today's interview.
Thank you.